Hey guys, this is Dr. Tonya, and in today's video, I wanted to take a few minutes to explain how you explain that you have cancer to a young child. You see, when I was diagnosed with breast cancer, my kids were about 2.5 years old, and it was really important for me that they understood what was going on because I knew that I was going to have surgery. I was having both of my breasts removed and reconstructed. I was having chemotherapy for 6 months, and I was going to need radiation therapy. And because of all of those different treatments, my relationship and my ability to interact with them was going to significantly change. There would be periods of time where I wouldn't be able to pick them up. They wouldn't be able to crawl on my lap, that I may be too sick to really interact with them at all. And because of my immune system, there may be some times where I might need to be isolated from them. So I really wanted to make sure that they knew what was going on before all of this started. So I wanted to take a few minutes to actually share the information that I learned with you about how you share your cancer diagnosis with your young children. Now, first of all, you want to be honest. You want to be completely honest, letting your kids know that you are sick, that you have cancer, but you want to make sure that it's age appropriate. So depending on how young the child is, you may need to use some analogies to actually show them what cancer is and how cancer acts in regards to the body, to help them understand, because their minds are still very young and they don't understand the complex concepts of how cancer can interact in the human body. So once you have explained using an analogy that they can understand what cancer is, you want to let them know that it is not their fault, that there is nothing that they did to cause it, and that there is nothing that they could have done to prevent it. And then you want to make sure that you allow them the time to ask questions. You want to definitely let them ask questions, and you want to make sure that you clear up any misconceptions that they may have around anything that you said, because you want to make sure that you guys are on the same page. Because what we explain out of our mouths sometimes is very, very different than what their little minds understand, because you may remember their view of the world is very limited. They don't understand very much. So we sometimes read into what we say, but they don't. They are very, very literal. So you need to make sure that they're understanding what you said. So once you clear up any misconceptions, you want to let them know, reassure their little minds that you are doing everything that you can possibly do to get better, to get healed, so that they understand that we are moving forward with this thing, that let them know it's okay to be scared, but let them know that we're all here to support each other. And for children who have, a parent that is very, very sick or is going through a lot, or a child that is especially fearful, you may need to employ some additional support for the family, some support outside the home, whether this is a child psychologist, a therapist, or even a support group designed specifically to support children, because there are some cancer centers that have support groups that are specifically designed to support children whose parents have cancer. The hospital where I worked had that type of support group. The kids got to go behind the scenes. They got to come to the radiation department, see the machines, see how it operated. They got to go to the chemotherapy clinic. So they got to learn behind the scenes what was going on, which helped them understand what was going on with their parent. So, and then you want to make sure that you allow them to support you in some way, whether it's drawing pictures, whether it's writing little notes, cards, or even helping out with small tasks around the house to support you. All of those things are important in making sure that children feel supported and included during this process. Because during those times when you're not going to be readily available to them, they need to feel like everything is going okay. So for me, what I was able to do to support my kids, who at the time were 2.5, is I actually wrote a book. And in the book that I wrote for them, I included a lot of these concepts that I just talked about. I used analogies to explain to them what cancer was so that they could understand it in their terms. And I'm so excited because in another video, I'm going to be reading that book for you so that you can use that book to support your children as well. So hopefully this video was helpful. If so, like this video, subscribe to this channel to keep getting important content to help you navigate through your cancer journey.